To many, America is seen as a land of freedom, opportunity, and equality. Unfortunately, the same sentiment is not shared by everyone, especially Black communities across the country. Hello, my name is Sarah Bishara.
Hi, my name is Emily Cox.
Hi, my name is Wilnie Larmagest.
In this presentation, we'll be going over the medical mistrust in Black communities across America. We will first be examining the root causes of medical mistrust in Black communities in America by looking at the history and former treatment of Black people in America. Then we will be looking at what is being done today to address the mistreatment in our special population and what changes have been made. Lastly, we'll be going over some new interventions that could successfully address medical mistrust in Black communities.
All right, now we're going to be starting with the history behind medical mistrust and causes. Next slide, please. When it comes to the start of medical mistrust amongst Black community, it is important to note mistrust stems from the historical events, including the Tuskegee syphilis study, and is reinforced by health systems issues and discriminatory events that continue to this day. The Tuskegee study was an observation done on African American males in Tuskegee, Alabama, between 1942 and 1972, and the U.S. Public Health Service ran this study on more than 300 people without notifying the participants about their disease nor treating them even after the introduction of penicillin. The study included recordings that progressed the disease, performing an autopsy on death. Since then, the trust amongst Black people and medical providers have been complex. Next slide. Besides the history being a huge factor that further plays into the mistrust with the Black community and health providers, it's also important to note how Black people's pain is being evaluated. Going back to history and the way structural racism plays a role in medicine, it was to believe that Black people have a high pain tolerance compared to their white counterparts, meaning they hardly felt pain. This myth unfortunately still plays a role in how healthcare currently operates. In fact, according to the Association of American Medical Colleges, half of white medical trainees believe this myth as Black people having thicker skin or less sensitive nerves endings than white people. An expert looked at how false notions and hidden bias fuels inadequate treatments of minorities' pain. This further goes into the notion of how there's a disparities in pain medications, being how white people are typically able to be overprescribed medication, while Black people are heavily underprescribed in prescription medicine. Next slide, please. This actually leads into complications in other sectors of health, such as maternal health. The reproductive health of Black women has been long compromised by interpersonal, institutional, and structural racism. In addition to contending with social and economic drivers of poor health and undermined Black Americans, they have experienced discriminatory health care practices and abuse from slavery to present. This being in mind, many Black women struggle with seeing health professionals regarding their pregnancy because they believe their concerns are not being taken seriously. And regardless of their socioeconomic backgrounds, they're still more likely to die from complications compared to their white counterparts. Additionally, despite the benefits of care during pregnancy and childbirth, racism still proves to be a barrier for Black women to access and receive quality care.
Now that we went over the history that Wilnie just reviewed, obviously all that has led to a lot of skepticism about medical care in the Black community. This has manifested today as Black communities having decreased access to healthcare and health services, Black communities being more likely to face social or economic challenges that go on to impact their health, and just discrimination in healthcare spaces because of their race. The decreased access and increased discrimination and economic and social challenges that has all occurred due to medical mistrust has led to an overall poorer health outcomes in Black communities. One example of this is looking at life expectancy. This chart shows that the Black population in America in 2021 had an average life expectancy of 70.8, which is lower than the overall average and that of many other race and ethnicity demographics. Additionally, they're in the Black community, they have the highest rates of maternal and infant mortality among racial groups in America. Black women and children disproportionately experience adverse health outcomes compared to other racial and ethnic groups, because Black women are 3 times more likely to die from pregnancy complications than white women. And this graph exemplifies how Infant mortality is higher in Black communities compared to other racial and ethnic groups in America. Public health officials attribute this to historical exposure to racial trauma and marginalization in healthcare spaces that has led to the wariness of medical institutions by Black women. Another example of this is not that the Black community has the highest incidence of cancer, so they don't have the highest rates of cancer, but they do have the highest rates of cancer mortality, as we can see by this chart where comparing the rate of white people dying by cancer and Black people dying by cancer. Now, the fact that the rates of cancer isn't the highest is very interesting because it directly shows the result of medical mistrust, which causes a lack of access to healthcare, which may cause the high rates of cancer mortality, or it may be caused by healthcare professionals constantly undertreating Black people, which is also one of the main sources of medical mistrust. One of the last examples we're going to look at is COVID-19, because the Black communities face the highest rates of hospitalization and deaths due to COVID-19, the lowest vaccination rates. This shows how the problem is still prevalent today because, as you can see by this chart, in 12 states, Black vaccination rates were significantly lower than white vaccination rates. Additionally, in regards to COVID-19, Black people were 1.1 times more likely to contract COVID, 2.8 times more likely to be hospitalized because of COVID, and 2 times more likely to die from COVID. Despite being only 13% of the population, Black people comprise 23% of COVID-19 deaths. Officials attribute all of these statistics to the low vaccination rates, which is because of the medical mistrust in the community. Now that we looked at the impact of medical mistrust, we'll go over some interventions to address the problem.
Thank you, Sarah. So after learning about the negative impacts that medical mistrust can have on communities and as well as its historical roots, I wanted to explore the way we can combat this medical mistrust and forge a path towards a healthier future. So as it has been highlighted through our presentation, in order to combat medical mistrust, we must confront its history honestly. We need to educate both healthcare providers and the community about these historical injustices, allowing for that rebuilding of trust. Next slide, please. So first and foremost, healthcare providers should undergo training that dives into the biases that have contributed to the mistrust. This education is not only about acknowledging past wrongs, but also understanding the cultural and socioeconomic factors that influence health-seeking behaviors. Training should emphasize communication strategies in order to bridge the information gap, dispel myths, and establish trusting relationships. Investing in training for healthcare professionals is an essential step towards removing the barriers of mistrust and creating a healthcare environment that is responsive to the needs of the Black community. Secondly, representation matters. We must strive for greater diversity in the healthcare workforce, ensuring that Black communities are served by professionals who understand their cultural and historical background. This not only includes doctors, but can also include nurses, researchers, and administrators. By fostering diversity in healthcare, we create an environment where individuals feel seen, heard, and understood. We also, education is crucial in dispelling the myths and misinformation that contributes to medical mistrust. So we can invest in community-based education programs that provide accurate information about medical procedures, research, and the importance of preventative care. And then lastly, improving accessibility is also extremely important. When healthcare services are easily accessible, individuals are more likely to engage with the healthcare system. Initiatives to establish community health centers, mobile clinics, and outreach programs can bring healthcare services directly to those who need them the most. Next slide, please. So now we're going to look at a discussion question that can promote conversations about how we as a community can continue to break down barriers regarding medical mistrust in the Black communities. Next slide, please. So our question is, what legislations or policies can be put into place to decrease the possibility for medical mistrust and increase utilization of healthcare among predominantly Black communities? So I'll let you think about that for a minute, and then we're going to talk about some of the answers that we came up with. Okay, so then we'll go over our questions or our answers now. So being able to turn to professionals who understand what you're going through is crucial to healthcare. So that's why we thought that requiring facilities to have the resources needed for healthy living, such as HIV testing and contraceptives, will strengthen trust and knowledge within the community. In addition, many states have passed cultural competency training legislation in order to improve patient engagement and overall status. This allows healthcare workers to understand different walks of life and what is going on in the world around them in order to be able to treat their patients to the best of their ability. And finally, incentive systems. So with COVID-19, many states such as California passed legislation that rewarded individuals for getting their vaccine with money, scholarships, and prizes. And so adding this into the community could provide an incentive for utilization of healthcare and could allow them to experience the benefits of healthcare. Next slide. In conclusion, combating medical mistrust in Black communities requires commitment, understanding, and collaboration. By providing accurate education, fostering diversity, and engaging communities, we can build a healthcare system that serves everyone. Thank you.